When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. As if innovative ultrasonic surgical technology and acid reflux treatment exclusive on the North Shore at St. Tammany Parish Hospital aren't exciting enough, Dr. Sohail Khan, an interventional cardiologist with Covington Cardiovascular Care at St. Tammany Parish Hospital, is here to talk about a novel approach to heart catheterization, which he likes to call the new route to the heart. Thank you for joining us today, Dr. Khan.
It's good to be here.
Now, I say the new route to the heart, but it's actually radial artery catheterization. What exactly does that mean?
Well, there are millions of heart catheterization or heart angiogram are performed every year, and the most common route is through the right groin, where the cardiologist threads a small tube, which we call catheter, through this artery, which we call femoral artery in the groin, all the way into the heart to diagnose heart attack or blockages in the heart. Now, it's the same procedure. The only difference is that the route is different. So instead of going through the groin, we are going through the wrist, through the small artery in the wrist, which we call the radial artery.
This is clearly new technology, a new way of doing it.
Right.
There's got to be a reason why we want to go through the wrist.
Well, there are several complications associated with the groin approach. First of all, the femoral artery is a big artery. So there are more bleeding complications. So if bleeding occurs outside the skin, it can lead to hematoma and bruises and discomfort that can last for days and days. If bleeding occurs inside the abdomen, it can really endanger life. And then if someone who has back issues, sometimes the patient has to lay in bed for anywhere from 4 hours to 8 hours. That can be very discomforting. And then there are studies after studies which have shown that radial artery access is superior than the groin access. It actually improves the survival in patients. So those are the reasons that we are really pushing for this new route to the heart at St. Tammany Parish Hospital.
This is a fairly new procedure that we're doing, but St. Tammany Parish Hospital is becoming a radial first hospital.
Right.
What does that mean?
That means that we are the radial first cath lab in the North Shore. That means if any patient walks into our cath lab, whether it's an acute heart attack or if they're having chest pain and they need a diagnostic angiogram, the radial artery access is our first option. And we will try to avoid the groin access because of the obvious complication and disadvantages that I just described.
Now I want to kind of go back, you talk about the disadvantages. What are, kind of the same vein, what are the advantages to going through the wrist? You talked about decreased recovery time, less pain.
Well, the radial artery is a very superficial artery. It's located in a very close space, so the bleeding almost never happens. That's number one. Number two is, again, as I said, there are studies after studies which have shown the survival benefit. The third thing is a very fast recovery time. Patient can actually walk right after their coronary angiogram, and as far as I'm concerned, my patients after angiogram, they go home within 1 hour. Even I can use the same route to deliver balloons and even deliver stents, and the patient can go home in 2 to 3 hours, so they don't have to lay in bed for 6, 7, 8 hours.
Wow. And so again, going through the groin isn't necessarily dangerous. Radial entry is just, it's more convenient and there's a lot more advantages to it.
Absolutely. Absolutely. And then, now the question is that is every cardiologist in this country is doing radial access? The answer is no. Again, as I said, it's the most common route, and is partly the reason is because the way the cardiologists were trained in the past. Partly is habit, partly is because everyone is doing it. Even we know there are clear advantages of radial over femoral artery. That's a trend that we need to change. And I would really suggest to the patients that when they walk into a cardiologist's office, and if they need angiogram for any reason because of chest pain or acute heart attack or acute heart failure, they should demand their cardiologist that they want their heart cath through the radial access because of the obvious advantages.
And of course, that's something that we always stress, no matter what the procedure or type of care you're receiving, is that we want patients to be involved with their health care. So definitely talk to your physician.
Absolutely.
Hopefully, you know, people have learned a little bit about the advantages and disadvantages of both.
Right.
So when they come in to see you or any physicians, any heart physicians, they'll ask for radial access.
Absolutely.
Now, a lot of great information. This is just one part, though, of why St. Tammany Parish Hospital ranks first in Louisiana and in the top 10% of hospitals nationwide when it comes to medical excellence for interventional coronary care, according to CareChex. That was a mouthful, but what does that mean for y'all, and what does that mean for our patients?
Well, we take a great pride. We have a great team of doctors, nurses, technical staff, cath lab staff, and this goes into the focus that we have on patient quality, patient safety, and we are number one in the state of Louisiana when it comes to the patient survival, their quality of care, their outcomes, their satisfaction, and the radial artery access is a step towards that goal. So I'm very proud of our team at St. Tammany Parish Hospital, and we will try our best to keep this tradition and keep it moving.
And the excitement doesn't stop there. I'm gonna real quick. There's so many other recognitions that we got for our cardiology care when it comes to that CareChex award. Top 10% nationally and in Louisiana for patient safety. For cardiac care, we're also first in the market for medical excellence when it comes to heart attack treatment, and we're also in the top 10% in Louisiana for heart attack and heart failure treatment. A lot of that is credited to our Covington Cardiovascular Care Clinic.
Absolutely, so we have a great team, and we have a great support from the community, as well as our administration. So that's a thing that we can improve on.
And we're always reporting on our website about the awesome procedures y'all are doing. If we could just briefly touch on, and we'll have you back again on our show later in the year, you're doing some great stuff with vein therapy and DVT. If you could just hit on those just real quick, we'll come back, definitely have you back on to revisit with
this.
This
is something that I've noticed that people, a lot of physicians, the patients, sometimes they really ignore when they see swelling in their feet, and they are living with that swelling and pain for years and years. So there's a condition called a venous reflux. Now there are two types of vessels in the legs: the arteries, which carries the clean blood towards the leg. Now once that blood is used by the leg, it becomes deoxygenated, and they have to flow back into the veins towards the heart. Now those veins have one-way valve, so when those valves are not working, the blood, instead of going up, it tends to pull back into the legs. That can lead to swelling, that can lead to prominent veins, pain, cramps in the leg. It's usually very common among females, and it tends to run in the families. So we have come up with this procedure that if they have venous reflux, if they have all those symptoms, swelling, edema, pain, we can actually put a small catheter into those abnormal veins and burn those veins. It's a non-invasive, it's a very low risk, minimally invasive procedure where patients can walk into the office and then can walk out within 1 hour. And it really works. Patient can feel better within a couple of hours to a couple of days.
It's so amazing, these procedures, that you can just get in and out, and the recovery time is next to none. But basically, that's what you were talking about, is varicose veins for the common person out there, and it's not just a cosmetic issue. It's actually a very dangerous health concern.
Well, sometimes you don't have to see the veins or obvious dilated veins in the legs to say whether someone has venous reflux or not. You may not see veins, but if they have swelling in the feet or pain in the legs, I would highly suggest that at least they can get a non-invasive ultrasound to diagnose that condition, and then we can take it from there.
Well, a lot of great stuff. I know we'll definitely, like I said, have you back on, get more into detail into those 2 treatments that we can do for cardiology patients. It's safe to say we're happy to have you and the entire team over at Covington Cardiovascular Care at St. Tammany Parish Hospital. So thanks for being with us today, Dr. Khan.
Thank you very much.
I appreciate it. And remember, you can always find out more about these and other innovative procedures on our website, stph.org. Make sure to check us out on Facebook, LinkedIn, Twitter. Thanks for watching, and we'll see you next time.